Welcome to Pennsylvania Newsmakers, and as always, thanks for watching. Well, this is National Domestic Violence Awareness Month, an important update on that. But first, how about an important update on what else but health care? You and your health, that all comes next.
This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host, Terry Madonna.
All right, we're going to skip the conventional politics that we do on this program and focus on a couple of very important policy issues, health issues, and domestic violence issues. This is important. We want to make sure that you get the latest news. Joining me is Dr. Michael J. Consuelos. He's a physician. He's also the Senior Vice President for Clinical Integration with the Hospital and Health System Association. I was joking with the doctor before we got on there that he has as long a title as most college professors, but we'll get on. Hey, thanks for coming.
Thank you, Terry.
Wonderful to help you. All right, there's something that you and I were chatting, and you said we want to talk about population health. That's a little different way than some folks might, average folks might think about it. What's that all mean?
Yeah, thank you, Terry. So traditionally, hospitals are places where sick people go to.
Yeah.
So I think what population health is where hospitals are playing roles in their community to keep people healthy. So think about health screenings, eye, dental, immunizations, making sure they have the right kind of food at home, exercising, what keeps the population around in their community healthy.
Yeah. So, I mean, essentially, I think we've come to take a lot of this for granted, but the early intervention, and you're a doc, you understand this, is critical to saving lives and to preventing much, how about long-term suffering?
Absolutely, Terry. And now that hospitals are really taking care of their community really from birth to grave, it's not just about taking care of them when they're sick. They really need to take care of them and keep them healthy throughout their entire life, but also make sure that they function. So as we get older and the generation gets older, to enjoy a happy life is really important.
Right. Now there's something that when we talk about this early intervention and, well, people are busy. As you know, we have a doctor shortage in parts of our state. We also have a specialty shortage in parts of our state. So this whole business of telehealth is really taking on a new life in the last couple of years. Give me some indication for our folks. How would that work?
Sure. Well, I look at telehealth as a force multiplier, meaning you could take one physician who may be at one of these specialty centers you talk about, and then through electronic means, they can communicate to patients in their homes or even to other physicians in, let's say, rural areas where those specialists may not be able to reach. So it's allowing them to reach more patients, more timely, more convenient, so the patient doesn't have to leave their community to go see a specialist in one of our large cities.
Right. So put it another way, you take this little thing right here, or a computer, or an iPad, and you can see a physician can talk to a patient, can interact, find out what the symptoms are. If it's something that people can see, a bruise, a cut, a mole or something, can show it on here, and that way the doc can say, okay, get off to a hospital right away. Go ahead, you're smiling.
No, that's absolutely correct. But even that, our emergency departments and our doctor's offices actually have electronic equipment that will look in the eyes, the ears, the mouth, listen to their lungs and heart remotely. So you can actually do basically an exam over electronic media and understand what's going on with the patient. So you mentioned the pictures are worth 1,000 words, but also interacting with a patient and actually having the physician speak directly to a patient as opposed to through a telephone, a face-to-face interaction.
Yep, and sometimes that's just not possible. So patient-physician relationship. If you live in an area or it's difficult to get to see a physician, should patients be suggesting this to doctors that maybe, hey doc, I'm having a problem, or you get a nurse or someone in an office that can assist her in a hospital? Should they be asking about this? Can we do this, using the internet?
Yeah, absolutely. And talking to their hospitals or their providers and seeing if that can happen. That's absolutely a good instruction.
Okay, we're going to switch. I want to talk about two things before I let you go. One is the opioid problem, and it's growing and growing, and politicians all over the country, not just in our state, are critically aware of it. But I do want to talk about something that's very important. In fact, you know, the SCHIP program in some respects has its origins in this state. The funding, what's the future for SCHIP given what's going on in Washington?
Sure. So the CHIP program funding ended on September 30th.
Right.
And there's a couple of bills being marked up to basically continue the funding. So absolutely, it's an important way to fund health care for children. Exactly, who are somewhere between the Medicaid support and regular insurance. So there's a sort of a gap there,
yeah.
and allows their parents to access health care, to receive well visits, immunizations, and keep them healthy and keep them out of the hospital.
Yeah, I mean, and it's an extremely important program. I forget the number. I won't even begin to venture of the folks in Pennsylvania, you know, the children who are covered by it, but it's a substantial number, and it's that gap that's very important. And, you know, there are lots of things we can argue about going on in Congress. We can argue about policies on so many things, but it seems to me this particular program has always gotten bipartisan support. There shouldn't be an issue at this point.
No, I mean, obviously there are a lot of things going on in Washington D.C. that keeps them busy. Yeah. Absolutely. So, but absolutely, we are 100% behind the reauthorization and funding of this very, very important program. And as far as Pennsylvania, there's about 175,000 kids who are covered.
Yeah.
So those are people in our families, our neighbors, our schools that really need the health.
All right, when we come back, I want to talk about this issue, the opioid crisis. That term crisis has been used over and over again. We'll check in and see how's it going? What advances are we making?
This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Chamber of Business and Industry, the statewide voice of business, and by the Pennsylvania State Education Association and Partners for Public Education, bringing the power of a great education to our schools, our students, and our communities. This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Highway Information Association, the go-to source to learn about transportation projects and issues. Please visit pahighwayinfo.org. And by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business.
Welcome back. I'm talking with Michael Consuelos. He's an MD. He is the clinical integration specialist. I think I got that right, with the Hospital and Healthsystem Association. All right, we've been chatting on this program about the opioid problem. The legislature has appropriated money. It's a major focus of the Wolf administration. And this statistic it's just stunning. 2016, about 13 people died of a drug-related overdose. Not each week, not each month, each day. Doctor, that's stunning.
Yeah, that's absolutely stunning. It is now the leading cause of accidental death here in our state. So more people die of drug overdoses than car accidents every day.
Yeah, and let me get this straight. I mean, this is important, I think, for people. You start out and you're maybe taking a drug for pain, you know, prescribed by a physician. Now, physicians are really aware of this opioid thing now, and doctors don't want to see patients in pain, so you give them a drug. In some cases, you know, a narcotic. It moves on, and after it's over, you're hooked?
Yeah, I think it's one way to think about it. It just changes the biology of the brain. It changes the way we sense pain. And it becomes just like breathing or drinking or eating. Our brain needs that opioid, that narcotic, to function normally. So it really alters the entire biology of the brain so that it craves it. And it's not just a sort of a falling on the moral side. This is a true biological change.
Right. That's a wonderful, I've never heard it put that way, but that's a wonderful way to think about it. And once that occurs, you're just hooked, and then your life can go through a death spiral. Tell me how hospitals obviously have had to adjust to this. I mean, it's not your typical automobile accident or somebody falls. This is a lot more complicated, it seems to me.
It is, and there's no magic bullet. There's no silver bullet to take care of this. So what hospitals are doing are sort of multi-pronged approach. One, as you mentioned already, is to decrease the amount of opioids that are being prescribed, right? So putting limits, especially for acute pain, right? So if you have an acute injury and you have some pain medicine, doctors now will be limiting the amount of opioids out there. So that's an important piece. The other part is that we can actually start some of the treatment in our emergency departments as in patients when we have identified someone with a substance abuse disorder, and start that treatment right away, and then move them into an area in their community to get the treatment they really need.
And what's really helpful, I think, is the database that, I mean, again, we're back to this and the fact that we can access so much so quickly. So you can actually get the history of a patient, of, you know, a physician's prescriptions to a patient with a, you know, a healthcare problem of some kind, and that helps you create a plan for the patient to, you know, get some badly needed assistance, right?
That's true. So sometimes if I were to see a patient and I knew that I was writing a prescription maybe for a week, but I don't know if they're going to another doctor, an emergency department in the region and getting multiple prescriptions. Now with the prescription database that we have access to, we can actually see the prescriptions these patients are taking. And that sends a red flag and says, now we have the conversation with the patient and say, look, we think you may have a problem.
And you're coordinating this with other hospitals, which is also important.
Right. So those are all through the hospitals in Pennsylvania, and then 11 other states. So the states that surround, because patients can cross borders into Maryland, New Jersey, West Virginia, and get those same medications. So now those systems talk to each other, so the physicians in our state and the surrounding states know what prescriptions patients are getting.
All right. Before I let you go, I have to ask you about the Affordable Care Act. Doesn't look like it's going to be ended. It could be mended at some point. What's the position of the Hospital Association on that?
Yeah, so the Hospital Association, along with the American Hospital Association, the AMA, and 30 other organizations here in Pennsylvania are strongly behind keeping the ACA. And you mentioned mending, and that's exactly right. So I think repealing it and taking away the much needed health care funding for our citizens here in Pennsylvania would be really a huge step back.
So your position should be, and I don't think even its most ardent supporters say there needs to be, in some cases, some pretty serious adjustments to it, but overall, you think finish my thought.
Yeah, so overall, it's the right thing for our people here in Pennsylvania, keeping them healthy. What we need to do is find the areas that need to be, for example, the marketplace of the insurance companies needs to be stabilized. There has to be the right amount of funding to keep that at lower cost for patients. Nobody thinks this is the most perfect system in the world, but it's the current system that we have that allows over 700,000 people in Pennsylvania to get health care where in the past they had not.
Yeah. Yeah, this is, and well, at the moment anyway, it looks like, you know, they failed to end it. Congress did. The Senate actually by one vote. It looks like they're moving on to tax reform. But is there much the states can do to help out here in terms of mending it, or is it essentially you think have to come more from the federal government?
Yeah, Terry, it's a federal law, right? So it's a federal system. It's very, very complicated. And I think what we can do as citizens of Pennsylvania is understand that it is complicated and it will take time, and to speak to our elected officials, our delegation down in Washington, D.C., and say, take your time, figure out what needs to be fixed. It took multiple years to get this off the ground. And I think we need to go the same direction in the future.
All right, it's wonderful to have you in. You provided, I think, a lot of helpful information to our viewers. All right, it's National Domestic Violence Awareness Month. We're going to talk about a couple of things here. You just might think about battered women or battered men, in some cases more women than men. But there's other aspects of this that are very important. We're going to get into that and more after these words.
This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Credit Union Association. Pennsylvania Credit Unions, where people are worth more than money. To find a credit union that is right for you, check out ibelong.org. And by the Energy Association of Pennsylvania, Pennsylvania's energy information source. This broadcast of Pennsylvania Newsmakers is presented by the Hospital and Healthsystem Association of Pennsylvania, working towards a healthy Pennsylvania.
Welcome back to the program, and joining me is Ellen Kramer. She's the Deputy Director of the Pennsylvania Coalition Against Domestic Violence. Pretty big month for you all.
It sure is.
And, you've come to recognize this month. What's the significance of it?
Well, October is Domestic Violence Awareness Month, which has huge significance for us here in Pennsylvania and across the country. It's the one month that we set aside specifically to honor the memories of the victims whose lives have been lost, to reconnect as a movement, and to pick up energy to accomplish our policy, our legislative agenda, and also just strengthen our services and make sure.
You know what, I was stunned when you provided me some helpful information for our discussion. 90,000 victims a year? Is that, am I right about that?
Unfortunately, it's the case.
Stunning to me.
Each year here in Pennsylvania, our network of domestic violence programs around the state serve up to 90,000 women, men, and children.
Yeah.
Yeah.
All right, if I had to ask you, I'm going to really put you on the spot. Give me a definition of domestic violence. How would you define it?
Well, we talk about domestic violence as a pattern of power and control perpetrated by one individual over another. It's either an intimate partner, or here in Pennsylvania, it could also be a family or household member. And it takes all sorts of forms.
Many forms.
Yeah.
Yeah, well, what about this? We used to think of this, I mean, I think a lot of people thought about it as, well, it's my family, stay out of it. But this transcends families, doesn't it?
It absolutely does, and I think that's the case. You know, back when our movement got started in the 70s, it was seen as a private family matter, and we've really opened the doors and windows on this, and we want people to understand that there's nothing private, that it impacts people all over our communities, and that it's important to speak up.
Yeah. Well, now, because it transcends the family, well, who knows? I mean, if it's depending on the form that it takes, the police can be called, there can be intervention by the courts. I mean, it can get pretty complicated. But you also have to deal with the legislature and making sure that the laws in this state protect people from this kind of violence, correct?
That's absolutely correct. You know, I like to say that here in Pennsylvania, we do have some of the strongest laws from anywhere around the nation, but they can always be improved. And most certainly at the Coalition, we're working very hard right now to strengthen our domestic violence law and firearms law, specifically around firearms issues.
Yeah. Well, the other aspect of this is that you may have laws, but I would suspect that much of this abuse takes place that's hidden, that's, you know, beneath us. You know what I mean? It's not something that's generally known unless the perpetrator is certainly not going to talk much about it, but the victims sometimes are too ashamed. I mean, this is my reading of this, and you're the expert.
You know, I think it's a really complicated issue, and what we see is a lot of reasons why victims may not come forward. Most certainly, there's an element of shame, and we think about that even more, particularly with male victims.
And fear.
And fear, absolutely. We know statistically that the time following a victim's first outreach to law enforcement or to the courts is the most deadly and dangerous time. And so as the victim makes moves to try to get help, they're really hit with a barrage of threats.
All right, we're going to run to a break. When we come back, I want to talk about some other aspects of this. We usually think of it in conventional terms as physical violence, but this has other ramifications. In our discussions, you even mentioned financial violence, however that's going to be work out. All right, we'll come back to this and more after these words.
This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Medical Society. Inspired physicians committed to the good health of Pennsylvanians and the advancement of the practice of medicine. And by the Pennsylvania Healthcare Association, advancing quality, improving lives.
Start out with that. Let's start. Well, it's National Domestic Violence Awareness Month. I'm talking with Ellen Kramer. She's the Deputy Director of the Pennsylvania Coalition Against Domestic Violence. We're going to put a phone number up here, and I want you can read the phone number, and I want you to tell me why you should use this phone number. And there it is.
Well, the Domestic Violence National Hotline number is 1-800-799-SAFE. Or 7233. So that's 1-800-799-7233. This is an absolutely life-saving number. What we want people to know, first and foremost, is that help is available, free and confidential help in every part of the state and across the country. So by calling this number, you get connected immediately with services in the community where you currently are.
All right, maybe I'm wrong about this, but traditionally we think of domestic violence as physical violence and, sometimes mental violence as well. But you also talk about financial, is that financial violence? Am I stating that right?
Well,
How would you state it?
We talk about financial abuse, and we know that up to 99% of all domestic violence victims are abused financially. So what that might mean is that they're not able to go to a job, maintain a job, finish their education. If they are working, they don't get to keep their paychecks. They don't have access to family resources or make any decisions about their finances. And that really cuts across all demographics of domestic violence victims.
Yeah. You also have something called Purple, I'm reading this, Purple Purse Challenge, to make sure I get it right.
You got it right.
What's that about?
In October, there's a national campaign promoted by the Allstate Foundation, the Purple Purse Challenge. We in Pennsylvania do it. It's entirely online, but the intention is to raise money and awareness about financial abuse and make sure that when victims leave abusive relationships, that they have access to financial education and some resources to get started again.
Now, I would imagine that there's probably a variety of reasons why people, when they get subjected to this abuse, violence, they stay. Some could be money, some could be fear, some could be, I guess it's possible to actually be in love with somebody who's victimizing you.
Well, I think you have to understand that first and foremost, these started as loving relationships.
Yeah.
And people do stay for a variety of reasons. It's complex. And you mentioned some really prominent ones. Also, having children makes it very complicated. And if you think about an abusive relationship and the power and control that the abuser maintains, they more often than not have convinced the victim that they're worthless, that they couldn't possibly make it on their own, or that if they leave, that the abuser is going to kill them.
So the psychology of this can be as important as the physical dimension.
Absolutely, absolutely.
Yeah. All right. Well, look, I want to thank you for coming in. I think this is an important update. There's a Father's Day pledge I want to quickly mention, and you say since 2013, 1,400 people have signed a pledge. Will you be promoting that as well?
We do this every Father's Day.
We're out of time. Thank you. All right. We'll see you next week for another edition of Pennsylvania Newsmakers, and as always, stay well.